TST.
Good evening, everyone. Welcome to our program, Clear on Health, on African Health TV. My name is Dr. Fumilayo Elusoji. I'll be your host today. With me in the studio is a guest, Dr. Liman, Dr. Idris Mohammed Liman, a consultant gynecologist with National Hospital. Welcome to the studio, sir. Thank you for joining us. Also with me is Dr. Olusegun Ajuwon. He's a consultant physician. Thank you so much for joining us, sir.
Thank you very much for having me.
Okay, so yesterday we started talking about diseases in general. We divided them into two major groups. The first was communicable disease and the second was non-communicable diseases. Now, for non-communicable diseases, we explain them as diseases that cannot be spread from one person to the next, and they are usually chronic. Sometimes they last for long periods of time. Now, we also did a statistics about non-communicable diseases in general. We said about 71% of deaths recorded, as said by World Health Organizations, are from non-communicable diseases. Now, non-communicable diseases can be divided into four major groups. The first are the cardiovascular group, diseases which can be hypertension, heart failure, or heart attack. The next group could be called cancers. We talked about different cancers in male, in female, and the ones that were in both sex. And then we talked about diabetes mellitus, and then we talked about chronic respiratory disease, which are chronic obstructive airway disease and asthma. Now, yesterday we talked about non-communicable diseases in Nigeria. And then there was a study we saw that was done in 2016 that showed that about 29% of all deaths that year was from non-communicable diseases. 11% of that total amount was caused by cardiovascular diseases. So today we're going to be talking about cardiovascular diseases. Our focus today would be on hypertension. Hypertension is a serious disease in Africa, in Nigeria. It's one of the leading causes of deaths in people, causes premature deaths in people. Most times it goes undiagnosed. People don't even know that they have hypertension. I'm going to be reading some statistics, in Nigeria. Now, high blood pressure puts 1 in 3 Nigerians at risk. This figure has grown by 540% since 1995. It's estimated that about 24 million people had hypertension in 2020, as against 4 million in 1995. Now, this rate is increasing faster in women than men, and more than half of the people with the condition in Nigeria are unaware that they have high blood pressure. Now, this is, and from the information we got about hypertension in Nigeria currently, it's something that everybody needs to be aware of. We don't have to take it lightly, and awareness is key. Information is also key. So, sir, Dr. Ajuwon, please, can you tell us what is hypertension?
Thank you very much.
Yes, sir.
Maybe this is the point to also say hypertension, raised blood pressure, high blood pressure are saying the same thing.
Sir.
So in the medical parlance, it is easier for us to say hypertension. But what we are saying is the blood pressure is higher than what is normal. Hypertension actually is a measure of the pressure the blood imparts on the arteries. And arteries are blood vessels that take away blood from the heart. So actually it's the heart, which is a muscular pump that generates this force to push blood around the body via the arteries. So each time the heart pumps, it generates this pressure, and such pressure can be measured on or over the arteries. So when the level is higher than normal, we now say this is hypertension. Hyper in the medical parlance is high.
Yes, sir.
So we are saying, so hypertension is elevated, persistently elevated blood pressure that when we measure it. So that is what hypertension is, and yeah, that's for definition. But what I want to stress here is that they say I have blood pressure, I don't have hypertension. That would be a wrong thing.
Okay.
Hypertension, raised blood pressure, elevated blood pressure, they mean the same thing. And it is what we measure. We can measure it, and there are correct ways of measuring blood pressure.
Yes, sir.
And maybe this is the time to say, is there a normal blood pressure?
Yes.
But for definition, it just means persistently elevated blood pressure higher than what is normal. Maybe we'll talk about normal with time.
Yes, sir.
Okay.
So you asked the question, is there a normal blood pressure? Is there a low blood pressure, sir?
Okay. Maybe I should. Okay, yes, there is a low blood pressure. Maybe this is the time to just put figures. The normal blood pressure in adults,
Yes, sir,
is blood pressure that is less than or not more than 120/80. Once I mention that, I have to also explain what do I mean by 120/80. When we measure it, and the blood first is able to overcome the pressure that we put, because usually an artery is occluded using a cuff, and we start to release the pressure gradually. So the very first time that blood is able to overcome that pressure, a sound will be heard. That is what we call the systolic blood pressure.
Yes.
And that's what is on top. Then, of course, we'll be hearing that sound, and at a point the sound will no longer be there because there's now a thoroughfare. At the time it ceases, it's called diastolic blood pressure. So we now record the top one. If it is 120, we say 120. If the second, the diastolic, if it is 80, we now record it as 120/80. So that is the normal blood pressure for adults. It becomes a problem when the blood pressure is higher, that systolic pressure is higher than 120/80. If the systolic blood pressure is higher than 120, we are saying you have elevated blood pressure. If it is 80 and below, that is normal. But what is taken generally in adults is we do not want a blood pressure that the systolic is higher than 140, diastolic is higher than 90. But if you ask me what is normal blood pressure, I will say, generally speaking, normal blood pressure should be below 120/80. Now, so there are stages, which means it can be lower than 120. The systolic can be lower than 120.
Yes, sir.
And this depends on age, because we will talk about it. With age, the blood pressure tends to go up. So if one has a systolic blood pressure of 110, between 110 and 120, that is normal blood pressure. Between 120 and 130, then we are saying, this is hypertension. If it is more than 140, then it's abnormal. So which means if you get between 120 and 130, depending on your age and your activity, we still say okay. But to answer precisely, 120/80 is the normal blood pressure. But even for an individual, it varies, especially the one on top, the systolic pressure, varies from time to time, depending on your activity. If you are excited, it goes up. If you are...
Hold on, sir. We have a caller coming in. Hello. Good evening.
Hello?
Hello, good evening.
Hello?
Hello, good evening. Can you hear me?
Hello?
Hello? Hello?
Good evening. We
Hello?
can hear you. Go ahead.
We can
If
hear
have a
you.
question.
Sorry, we lost that caller. Please do try to call us back. Our number is 090-7111-5342. Sir, sorry for that break.
Right.
Can you?
So I was saying that there is a normal blood pressure.
Yes, sir.
And if you want to go home and dance and look, your blood pressure is normal, then it is, this systolic is no more than 120, diastolic is no more than 80. But if it is still between 120 and 139, we are saying, well, let's watch it, especially if you are older than 35 years old. But once your blood pressure is now 140/90, that is hypertension. We diagnose it. But again, I said it varies every day. Even my own blood pressure varies depending on what I am doing. It means, but I have an average blood pressure. So that's why when we measure, depending on which machine we are using, maybe tomorrow we'll demonstrate the various machines that we're using. I expect that it should, the systolic, that's the top one, should not be more than 120. But once, that is, if it happens that it's more than that, it should be taken again while the person is resting and relaxed.
Please hold on, sir. Let's take this caller. Hello? Hello?
Hello?
Good evening. Can you hear me, please?
Hello?
Hello, good evening. You're on to Clear on Health, TSTV. Hello? We lost that caller. Sorry, sir. Okay.
All right.
Okay.
Yeah.
Yes, sir.
So I'm saying that it varies. If you are excited, your blood pressure, especially the systolic blood pressure, rises a little if you are excited. But so if one finds that, you now ask the patient to relax and you repeat it. Especially the type that we will show tomorrow that you can do yourself, that uses battery. That one is so sensitive that it is recommended that you should measure it at least 3 times and take the average. So there is a normal blood pressure. Is there a low blood pressure? Or maybe before I talk about low blood pressure, there are stages too. I said 120/80 is normal. Between 120 and 130, we are saying it's elevated. If it is more than 140, then we say this is hypertension. So, and then there are stages too. Between 120 and 140 is, a hypertension. If the systolic is between 140 and 159, then that is stage 1.
Okay.
If the systolic between 159 and 159, so anything higher than 160, we say that is stage 2. And of course, anything higher than 180, that's a hypertensive crisis. These are various stages of blood pressure, but there is a normal blood pressure, as I've said. Now, is there a low blood pressure? The lower the blood pressure, the better. But again, if the blood pressure is too low, especially the systolic, if it's lower than 100, and the diastolic is lower than 90, and the diastolic is lower than 60, that is also dangerous, because whoever who has such a blood pressure is likely to feel dizzy if he gets up. But if it is not lower than 90/60, we still say that is still within normal.
Okay, sir.
Right.
Thank you, sir, for that explanation. Also, you talked about if blood pressure is elevated to 140 above 140/90, we call that hypertension.
Yes.
If that reading is gotten and the first time the doctor meets the patient, would the patient be told that they are hypertensive?
Because of the way the treatment goes. Because once we label you correctly as hypertensive, you'll be on treatment for the rest of your life. Treatment. It may change, it may vary. What is called treatment may change, but you are on treatment for life. So we don't bandy such diagnosis anyhow.
Okay.
So as I said, because it varies.
So, sir, sorry about that. We'll be going on a break shortly. Please do join us when we come back. Thank you.
Okay.
Connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome to Clear on Health.
TSTV, connecting your world.
Welcome back, viewers. Before we went on a break, we were talking about hypertension. We talked about a brief statistics of what it has been in Nigeria. Dr. Ajuwan was talking to us about the definition of hypertension and how to recognize when you have a high blood pressure or a low blood pressure. So before we went on the break, you were talking about when is hypertension diagnosed? Is it at the first time the patient sees the doctor or on subsequent visits?
Well, if the level is very high, well, let's say talking generally, we don't make the diagnosis based on just one reading.
Yes, sir.
Because it is possible that your blood pressure machine is faulty, especially if you are using the anaerod, the portable type. So we don't give a diagnosis of hypertension with just one reading. We would like to repeat it. Either there, after that one, you allow the patient to relax, and then you take it again. But if possible, you can let the patient go. Please avoid coffee when you are coming, don't take coffee, and then you repeat it. So if the blood pressure is repeated on three different times and is elevated, then you just tell the patient that, look, you have hypertension.
Yeah.
So that is when we make the diagnosis. This is important because, as I said, blood pressure fluctuates. If you are excited, if you are frightened, it tends to rise. So that's why we do not just label everybody the first time you see them with an elevated blood pressure as being abnormal.
Yes.
Right.
Okay.
But as I said, we still take normality, we extend it to below 140, the systolic of below 140. But if you are praying, you want to have normal blood pressure, let it not be higher than 120/80.
Yes, sir. Thank you so much for that explanation. Now, sir, what are some of the signs or symptoms people would complain about when they have high blood pressure?
I think that is a million naira question.
Yes, sir.
The reason is 1 in 3 patients or persons with high blood pressure may have no symptoms at all.
Okay.
May have no symptoms at all. And in fact, the people that have symptoms, it's usually when it is severely elevated. Because it is possible for you to go about with high blood pressure without symptoms. That is why the hypertension is also one of the, in fact, probably the monitor in the class of silent killers, because there may be no problem. But usually when the blood pressure is severely elevated, then the common symptom might be severe headache. Then we have some visual disturbance. In severe cases, you might even have nose bleeding. A sudden onset of nose bleeding might also be an indication that there is a problem. Also, if you are confused, or if somebody is confused, for no reason, it might be an indication that the blood pressure is very high. Then you have abnormal beating of the heart, which we call palpitations or missed beats. That may also be an indication that the blood pressure is high. Okay. So the important one is there may be no symptoms at all, which means, please, for you to know that you have blood pressure or you don't have, regular check is important. Yes, sir. Because it might not give you any sign. Okay. If you are lucky, or people that are lucky are the ones that will say, I have this headache, and they check the blood pressure and it is high. Yes. So those are lucky ones, but there might be no symptoms at all. Okay. So it is very important, and we can't overstress it, that even if you are not feeling anything, even if there is no problem whatsoever, please walk into a health center and ask that your blood pressure be checked. And if I may just ask, doctor, when was the last time you checked your own blood pressure?
Oh, okay, sir. That was about a month ago.
Dr. Liman? 2 weeks ago. Well, the good example. I checked mine last night. Maybe because I knew I was coming to talk here. So it's a
Thank
good
you,
thing
sir.
for us to check. Please, it might give no signs at all.
Yes.
But the few signs may even be signs of the problems. Because if you have chest pain, might be a symptom that some people will have. Difficulty in breathing might be some people what will take people to the hospital. That is when maybe the heart is now failing or is complaining of lack of blood. That's why you have such symptoms. So please, let's not wait until you have symptoms. Just make it a habit.
Okay,
Especially once you're above the age of 35, make it a habit, even if it is just once a year. Does that mean children cannot have blood pressure? No. Children can also have blood pressure, but they may not be able to complain. That's why the pediatricians, they also don't forget to check blood pressure. Maybe this is also the point to say the size of the cough. As I said, we'll try and show an example of the size, we know what we are talking. The size of the cough may also matter, because if the cough is too small for somebody who is fat, it might give a wrong reading. Also, if you are using the portable machine, it might also give you wrong reading. Because if the machine is working and maybe somebody knocks and you turn your neck, it will read as an abnormal blood pressure. So it is important too that when you are doing it yourself, and even if somebody is doing it for you with the electronic blood pressure machine, it is good to do it more than once.
Thank you so much, sir. Now, is there any gender difference in relation to high blood pressure?
It is a funny
Please
relation.
hold that thought, sir.
Right.
Dear viewers, we'll be going on a break now. Please do join us when we come back. Thank you.
And welcome to Clear on Health.
Okay, so before we went on the break, we were talking about, I was asking Dr. Adjunwa if there was any gender difference.
Yeah, and I said, yeah, that's a funny one.
Yes, sir.
Generally speaking, even in Nigeria, men are more prone to developing hypertension than women before menopause. But after menopause, the stories seem to change.
Yes.
And then there are some special situations which maybe Dr. Liman will have time today to talk to us about, because because of the gender difference, they are more prone to developing hypertension. So yes, there is, but generally speaking, men are more prone to developing hypertension than women before a woman reaches menopause. But after menopause, the frequency or the incident increases after menopause in women.
Okay, sir.
Right.
Thank you, sir. Dr. Liman, please, can pregnancy in women cause hypertension?
Yes. There is this type of hypertension that is associated with pregnancy,
Yes, sir.
and it comes on only when a woman is pregnant and it resolves spontaneously after termination of that pregnancy. I chose the word termination because sometimes the problem of hypertension may not allow pregnancy to reach maturity for delivery. So, whichever way, either the pregnancy has reached maturity and the baby is delivered alive or dead, the hypertension resolves spontaneously. But if on the other hand, the hypertension, pregnancy associated hypertension is so prominent that it has caused complications in the pregnancy, or you have to terminate that pregnancy to save the mother's life, then after sometimes the hypertension is first diagnosed in pregnancy, and even after pregnancy, it continues. So that is another, variant of pregnancy-induced hypertension. But the common one that is called pregnancy-induced hypertension is that it resolves after the pregnancy has ended.
Okay, sir. What are some of the signs or symptoms that this pregnant patient would complain about?
Well, sometimes, as is explained earlier on, even in non-pregnant people, it's like silence. That brings to fore the power of antenatal care. Antenatal care is that care given to a pregnant woman to ensure that the pregnancy goes on smoothly without, untold consequences. In doing antenatal care, part of it is regular blood pressure check, especially on every visit to the antenatal care. Antenatal clinic. So at that point, a normal pregnant woman that has just come, as she has come 2, 3, 4 times earlier, appear before you in the consulting room, and you look at the blood pressure taken for that day, it is high. But if it's not peak on that, then it is very high and is already given, problems. One of the ways you can, the signs that will tell you this woman might be having pregnancy-induced hypertension is she complains of headache, just as in regular way, or blurring visions, or flashy lights in the eyes, or sudden loss of sight. Some pregnant women may not know that they have blood pressure that is high, and it's very, very high, until suddenly she said, NEPA took light. And the people around with her in the room say, no, but there is light on. She's not seeing. This is complication. This is one of the complications of pregnancy induced hypertension. Then, without signs, part of benefit of antenatal care is we check the urine for every visit. And the only way that attention could be placed on blood pressure in this pregnant woman is if we found that there is protein loss, significant protein loss in the urine. Then we'll go back and look at the angle of the blood pressure, because it means the blood pressure is high, she doesn't have any problem or symptoms, and it is affecting the kidney to the extent that the kidney is no longer holding back the protein that it should sieve back into the blood system. The protein is being lost into the urine. That is another way we can pick up, a pregnant woman that have hypertension.
Thank you, sir, for that explanation. One of the things I got from the explanation was that it is silent.
It's silent.
And it goes for both male, female, even in
pregnancy,
it
yes.
is silent. Sir, is there a particular gestational age, or some women will call it how many months am I going to be? How many months? Instead of saying I'm 17 weeks, they'll say I'm 2 months, or I'm 4 months, or 5 months. Is there a particular time in pregnancy that you can diagnose hypertension in pregnancy?
Yes, let me just quickly lay this template for proper understanding of hypertensive diseases in pregnancy. An hypertensive woman can get pregnant. At that point that pregnancy sets in, meeting existing hypertension, it has become, a hypertensive disease of pregnancy. But a normal woman or normal blood pressure woman that became pregnant and everything was normal, certainly she was found to have elevated blood pressure or hypertension. Then that is pregnancy induced. That is, pregnancy processes have caused the hypertension to be started in that patient. And that is the one that reverses after pregnancy has ended. Now, for any woman to be said to have pregnancy-induced hypertension, it means she has normal blood pressure up to halfway in pregnancy. That is 5 months, that's 20 weeks. It is after 20 weeks that any elevated blood pressure is termed pregnancy-induced hypertension. Before then, there are explanations for it. One is she had been hypertensive, known or unknown, even before pregnancy sets in. It's only first known, probably in pregnancy, if the woman is 2-3 months pregnant. That is one. Two, certain type of pregnancies, abnormal pregnancies, also is associated with elevated blood pressure hypertension. I don't need to go into the technicalities of that. So that is why, and again, the blood pressure, the pregnancy and the blood pressure behavior, maintains, as pregnancy advances, the blood pressure should, calm down the more because of elaboration of pregnancy hormone, progesterone, and estrogens. These hormones are vasodilators, relaxers of the vessels or arteries that Dr. Ajon spoke about earlier on. So it is expected that if the vessels are relaxed, then the pressure should go down. But for whatever reason, if pregnancy processes is associated with failure of this relaxation, it will show after 5 months, that is 20 weeks. At that point, we said this patient has pregnancy-induced hypertension.
Thank you so much for that answer, sir.
Is it also possible to prevent hypertension in pregnancy? Are there things that people can do to prevent hypertension in pregnancy?
Really, even in non-pregnancy states, I don't know what Dr. John will say to that, but pregnancy, there are risk factors because pregnancy, hypertension is not what you say this is actually the cause, especially as hypertension we're talking about. There is no fixed cause that you say this is the cause of this hypertension, so let me take it away or take it out and the hypertension is gone.
Yes, sir.
It is a natural process, essential hypertension that doesn't have a cause but risk factors. And these risk factors are what we human beings in different engagements in life have to contend with. Is it the body size? That is somebody who is obese. Is it your activity? Is it, what I mean by activity is, are you a banker or a top-notch administrator who has a lot of responsibility?
Yeah.
How many of these responsibility are you delegating out? And so on and so forth. Which if you look, it cut across male and female gender nowadays. So because these risk factors are there, you cannot change your age. As the age advances, the tendency of blood pressure to go up is there. It has been told earlier on by Dr. Ajuwan. So you can't undo your age and say, I must remain at 21 years old all my life. There will be a point that you will be 62, 58, and so on. At that point, naturally, because of your aging process, the blood pressure should go up.
Yes.
So the prevention of hypertension in pregnancy is, I would say, there is nothing that is at today you can hold on to say, if I do this, I will prevent it. But there are measures that scientific research has brought out, which is in practice, that if a pregnant woman is having the risks factors for developing pregnancy-induced hypertension, so before pregnancy, there is what we call preconceptional care. At this preconceptional care, you can start some of these medications that have been found to help in delay the onset of hypertension, that's pregnancy-induced hypertension.
Yes.
And when it's even starts to occur on this medication, it reduces this rapidity by which the pregnancy-induced hypertension, goes to high level and damage or cause complication in pregnancy.
Okay.
So there are those measures that are available, but those measures are not that if you adopt them, it will prevent it from coming. Those who have predisposition to it will still have that predisposition and it can play out.
Okay.
But the fact that you have the predisposition also does not make it 100% that you must develop hypertension.
Okay, sir.
Whether in pregnancy or in non-pregnancy state.
Okay, sir.
So maybe this is the point to now say, are there risk factors? Yes.
Okay.
It has just been mentioned that there are risk factors. for developing hypertension in everybody.
Yes.
Whether you are pregnant, whether you are not, whether you are a man, whether you are a woman, there are risk factors.
Yes.
There are some that you can do something about. There are some that you cannot do something about. Genetics is one of them. You can't do anything if, because we know that if your parent, one of them is, hypertensive, it is just telling you that you also have a tendency.
To develop
if the two of them are, the tendency is even higher. So genetics plays a part, and there's nothing you can do about genetics. Also, we, in other places, you find that people that are in the West, like Afro-Americans, it seems to be more in them than, if you compare them to the Caucasian. They just have more tendency, and the only thing is gender, is their genetics. Another thing that we cannot change is the gender. We have just been told now that if you are pregnant, and unless something is wrong, it's only women that get pregnant. So if you are pregnant, you are more at risk compared to your age grade, who is not a woman or who is not pregnant. So gender, there is nothing we can do about that one too. But there are things that we can do something about.
Yes.
And I think that is important for us to stress it. Lifestyle, environment. Lifestyle, we are saying, what goes into your mouth and how much of it you use. So smoking, please, no. Because it affects the blood vessels.
Yes.
And we are saying the heart, which is a muscular pump, has to generate enough power to push blood around the body, whichever position somebody is adopting. If I'm standing, blood must still get to my brain. If I'm lying down, the heart will do less work to get blood to my brain.
Yes.
If I am doing an exercise, and we know people that they dance on their head, blood must still be reaching the leg. So we are saying the heart will now have to work harder if the blood vessels, especially the arteries, are narrowed. So we can do something about that. Smoking narrows the blood vessels. So let us say, quit smoking. And if you have somebody who is smoking, stay away from such a person as much as possible, because the man who is smoking is harming his own blood vessels. You that you are inhaling the smoke, you are a secondary smoker. You are also getting it. And that's why I'm happy that in Nigeria, at least, smoking is banned in public places. There are designated areas that you can go and smoke.
Yes.
Then alcohol. We also know that excessive use of alcohol tends to also injure the blood vessels and predisposes to developing hypertension. So we can do something about that. Food is also something that, look, if you eat too much, you add too much, and especially we are saying food that is too rich in salt, too rich in fat, in fatty foods, where such food also predisposes. Some people, too much stress is also a predisposition. It's not a direct cause, but it predisposes one to developing hypertension.
Yes.
And also, if you develop hypertension and you do not do something about the stress, it becomes more difficult to manage. So these are things we can do something about. We can do something about such risk factors. Hypertension could be primary. Dr. Liman was saying there are those that we don't know about. Majority, more than 90% of cases, that is to say, if you have 100 people with high blood pressure or hypertension, 95 of them, you will look for the reason you may not find, apart from maybe somebody in the family. So it's idiopathic or essential. So you probably will hear that one, or you Google and say essential hypertension. That we don't know the cause. So the one you don't know the cause, at least we know the risk factors. So avoid the risk factors, do exercise, just like we said, what you put inside and how much you use. Exercise or inactivity.
Yes.
Lack of exercise and inactivity also predisposes to developing hypertension. So we can do something about that. And every age is good to go when it comes to exercise. It is very safe. There are some disease conditions too that can lead to hypertension. Those are called secondary hypertension. So if, like, you know, when I talked about 100 people, the 5, if we check, we might find that, oh, he or she also has another hormonal disease, like maybe he has hyperthyroidism, or is producing, his pituitary or adrenals are producing too much steroids. You know, such can also. So if you can deal with the primary disease, you can cure such hypertension. But the one that you don't know the cause, you cannot talk about cure, you can only manage. So when we see somebody that has high blood pressure, yeah, even though they are few, but we still investigate to know, is it due to something? Overweight also predisposes to hypertension. So if somebody can lose weight by proper lifestyle, watching what you eat, doing exercise to bring down the weight, then we know we can do something about such. So these are some of the risk factors. So if you will also check on the internet, you hear there is DASH, that there is a diet they call DASH. That is to say, you know, you can. They are just talking about food that is rich in fruits, fresh fruits and nuts, but you know, less of salt, and rich fruits that are rich in potassium, magnesium, like common banana. It's very rich, so it's good.
Yes.
As part of your menu. Just like we said before, though, because we say something is good does not mean you should overdo it. And then salt. The doyen, one of the doyens of hypertension in Nigeria, our teacher, late Professor Akikugbe, went to Koma. You know, maybe you hear of Koma. It was they live on the hills somewhere in Gongola, then now in Adamawa. They live on the hills. Hardly would they come down to do anything. I mean, they dress almost naked. They go about almost naked. He found that because they eat less salt, the incidence of high blood pressure in them was much lower, which agrees with the findings in elsewhere that if you reduce your salt intake, you are also reducing your risk of developing hypertension.
Okay, sir. Thank you so much for that explanation. I wanted to ask, if hypertension is not treated as at when due, what are some of the dangers of having it for so long? Because there was a study I saw on online that talks about the total number of people diagnosed with hypertension, 42%, less than half of 42% of them are even on any medication or any form of treatment. So that shows that even with the awareness of having known that you're diagnosed with hypertension, most people would not be treated for it.
Okay, let's put it this way. I said at a point that once you make that diagnosis of hypertension, your treatment starts from that time and it continues for life. But treatment does not necessarily mean you are going to swallow drug or they are going to give you injection. Treatment might just be changing your lifestyle and keep coming for checkup. So there are non-drug treatment or non-drug management of hypertension. If we find that, look, it is because of stress, Dr. Liman just reminded us that we should delegate.
Yes.
We said that before. Don't be too busy. Life is, if you drop dead, somebody will take over that responsibility almost immediately.
Very true, sir.
So don't overstress yourself. Because as I said, stress is a predisposing factor. It's also a mitigating, a limiting factor to proper treatment. So there is drug and there is non-drug treatment. So usually we try the non-drug treatment for everybody first. Unless, of course, it is very high. If it is very high, there are dangers. I said there is what we call hypertensive crisis, which could be urgency or emergency. If organs are damaged, like, they check and a patient is bleeding inside the eye, or you are bleeding inside the kidney, that blood is now coming out in the urine.
Yes.
It could be microscopic or small amount of blood. Once you get that, and the blood pressure, the systolic is higher than 180, the diastolic is higher than 120, that requires admission. And it is a crime, not almost, it is a crime for a doctor to see a patient, measure the blood pressure, and you find that the systolic is more than 180, or especially the diastolic is more than 120. That patient requires admission. And you must try to bring the blood pressure down. Again, there are dangers of crashing of the blood, the blood pressure. But these are things that leave the people that know how to manage it to manage it. But the point is, if you go to check and you say you have severe hypertension, like I've just mentioned the figures, there are those that will require hospital admission and immediate treatment to bring the blood pressure down safely. And there are drugs, several classes of drugs. And because of the causation, what we know about, or the physiology of high blood pressure, there are different classes that will attack this elevated blood pressure at these different levels. Maybe just to say there are drugs, specialized drugs, rather than me to mention the drugs now and then somebody will start to self-medicate. So the important thing is treatment is for life,
Yes.
which means please go and find out whether you have a hypertension. If the answer is yes, you have high blood because they have checked it 3 times, it is above normal, then agree to have treatment. And treatment is for life. That means please don't go away. Maybe you didn't have a headache before. Maybe you didn't have palpitations before. Maybe now that you are feeling well, you say, well, I'm okay. Or I checked and it's normal. If you stop whatever treatment you have been given, the blood pressure will slowly rise again without it, and it may give you no warning. It may not give any warning until we now have problems. And the problems, if we have time, the problems are many.
Yes.
The blood vessels that is under pressure can actually burst. It can burst. If it bursts, we are saying, just like if you have a pipe burst, the people at the end of the pipe burst will not have water. So the blood supply to the distal organs will be jeopardized. And if blood supply is removed for minutes, they die. So we can have stroke.
Yes.
You can bleed into your kidneys. You can also have problem inside the heart itself, the pump that is. So there are complications that can arise. So that's why, if we have not said any, or if you have not had anything today, we are saying high blood pressure may not show, and unless somebody checks it, you may not know that you are going about with high blood pressure. And because of the complications, I just mentioned stroke. We also said the eye can actually lead to big problems in the eye, which may lead to blindness. It may also have problems with the kidneys and may lead to kidney failure. The heart, you can have what we call heart attack or heart failure because of untreated hypertension. So these are things that are preventable, and that's why we are saying, let's make it clear. Are there herbs that can help? Maybe there are effective herbs, but until they are proven, because the problem with science is, if there is no control, you cannot conclude.
Yes.
If you say these leaves, just eat 5 every day, we have to be able to say, okay, you believe that, eat the 5. We look for somebody that is about your size, maybe the same gender with you, that we eat maybe another leaf. Then we compare your results. That's the only time if we now find a majority of people that eat that leaf, they have good effect, then we can say, there is some potential.
Yes.
And we have NIPRID in Nigeria.
Thank you so much, sir, for these explanations. We'll be going on a break now, and when we come back, we'll continue talking about hypertension. Thank you.
TSTV, connecting your world.
Good evening, viewers. Thank you for joining us on our program today, Clear on Health. We've been talking about hypertension. I'm in the studio with Dr. Idris Mohammed Liman and Dr. Olusegun Ajuwon. They've been, informing us about what hypertension is about. We're so sorry for those trying to call in and are not able to reach us. Please take note of your questions. Tomorrow we'll leave ample time for those questions to be attended to. So, Dr. Liman, Dr. Ajuwon said a lot of things about, people managing hypertension when they are diagnosed, how to manage it. And he said it wasn't just drug alone. You could also use lifestyle, and, manage diets. Well, sir, in your opinion, what is the reason why patients diagnosed with hypertension do not seek care or management, especially within the hospitals?
Well, healthcare in Nigeria is mostly, out of pocket, savvy or being paid for by individuals. And the financial power of most people in Nigeria is low. So some people are struggling on how they get to the hospital where they will be, their blood pressure will be checked first in terms of transportation. Not to talk after it has been checked and any medication is written, purchasing those medications. And unfortunately, as Dr. Ajuwon have said, essential hypertension is a lifelong matter. So, and the only thing that one will stress in this lifelong matter of essential hypertension is that if you manage it well, if you struggle to keep managing it well and keep the blood pressure under control, you will live as long as possible in a sound health. The only difference between you and somebody who is not hypertensive will be some management modalities that have been placed on you, placed for you to have a low blood pressure, which may not necessarily be drug to swallow and so on, just lifestyle modification. Let me just digress quickly and talk about stress management. Nigeria of today is full of stress. And back in the days, we used to have the kind of life we call type A personality. He is the chairman of their ethnic group in the city. He is the ward head of the estate he is in. He is also representing the group in the office. He is representing the market woman of where the wife is. A lot of things. One man.
I hope you are not talking about somebody.
No, sir. There are people like that, and it's getting worse because you want to engage in so many things to make ends meet. We got to do that with the background of I must be well and alive to even keep up. So do the needful and then get what is sufficient to keep life going. So because of financial issues, some people may have hypertension, not that they don't want to come, but they don't have the means to come. And this brings to fore, again, most of those who are hypertensive in non-pregnant state are advanced aged people, either retirees or an elderly woman back in the village. Probably the children, they are not around in the village. It depends on how the children look back to the old mother in the village and make sure that her health needs and other needs that the woman will need is provided. So this is where we want to enlighten people that yes, we all in the cities, both within the country, in Nigeria and abroad, we have elderly people back home. It's not when we are coming back for Salah or Christmas alone that we should carry every good late ends and bring it home and want to earn blessing. We should put them in our budget monthly in terms of what is our health need, what is his health need, what is his basic need. Something as not too important, I would say, in terms of health, as phone bill, that is recharge card. Because these are people that have labored their youth to send us to school. And we have become something we just want, charge into the world, forgetting until we are coming back for, festivities. So basically, I think that is one of the reasons. Another reason is there is still myth and misconception about hypertension. Somebody, because he's a silent killer, or silent problem in most, in a significant portion, the person does not check to find out whether he has hypertension or not, and suddenly maybe he has stroke and collapse. It will be now read against one witchcraft or somebody who is at loggerhead with their family back in the village, pursuing this progressive man that, son of the soil that is making waves in the society, so that the family will crumble by, maybe if he has gotten stroke, which is not. Hypertension, there is nothing like somebody, or when you eat, when somebody look at you with the left angle of the eye, it will cause you to have hypertension. You have to check. You may be carrying hypertension. Or in some other places, they say when you move around at certain evening times or around the river, you step on the spirit child. The spirit is angry with you, he hits you, and then you fall and you now develop stroke, or you die instantly. Or partial paralysis, half body paralyzed. Next morning, say, he went and offended the gods, step on their child and around the river line. That's why he collapsed there. And all those are misconception. So there's still this belief in certain quarters, which I believe the health sector and everybody is working hard to enlighten people that there is nothing like that in hypertension. No. You may have it because it's silent, go and check. And nobody look at somebody on the forehead or in the palm and say you have high blood pressure. You must apply sphygmomanometer. So I wonder how somebody will be talking about hypertension when he doesn't know what sphygmomanometer is. You cannot, call something a smoke if you have not been showed that this is smoke and these are the characteristics. You start talking about smoke when you are not taught and you don't know how to identify a smoke, you will be talking in heresy. So these are some of the issues mitigating against, significant progress in management of hypertension.
Thank you so much, sir, for that reply. So far we've been talking about hypertension. We've talked about it in Nigeria. We talked about some of the risk factors. We went to talk about some of the complications. We also talked about hypertension in pregnancy. And we also were able to show that hypertension can happen in both male and female, and even in young and old people. And everybody needs to be aware of their blood pressure. We also heard from Dr. Liman. He said you can't wish away high blood pressure. There are certain factors that can, predispose people to having high blood pressure. One of them is as population aging. We can't change that. People will definitely grow old. And then, rapid urbanization we're having now. We have change in our diet. People are eating more foods that, is eaten in the Western world. Everything has changed. So now this is changing what hypertension looks like currently in Nigeria as compared to years back. So these are some of the things we've said to enlighten you. We want you to be clear on your health. We want you to make good health choices, and then want you to do what's best for you so that you can be alive to do what you need to do on earth as God has brought you. So thank you so much for joining us. Thank you, Dr. Ajunwo, for coming on this program. Thank you, Dr. Liman. We appreciate you being around. So till next week when we'll meet, and we'll continue till tomorrow we'll meet and talk about more on hypertension. Thank you so much for joining us.
healthy recipes of food for thought, showing next on AHTV.
First up, and you cook it just a little bit longer so that the milk solids in it get nice and toasted, and it brings this really lovely nutty flavor to everything. I love this stuff, and it is wonderful on popcorn.